Today we'll be discussing on the standing orders. In the previous section, we've had about the preamble and the necessary instructions on how to use the standing orders. In this section, we shall practicalize how to find complaints in the standing orders and also other things. I'm Ezra Onyeka. The standing orders is defined as a comprehensive set of specific guidelines arranged by age group, conditions, findings, that is, findings from history, physical examination, laboratory investigations, then clinical judgment, and necessary actions to standardize care for patients at primary health care facilities. This is a definition given by the Committed Practitioners Board of Nigeria. In the previous section, we have discussed this definition. So you go and take that particular section. Important note, in the new standing orders and other standing orders editions, this is a very important note that's usually found in the important tool. The standing orders do not replace clinical judgment and critical thinking. Thus, committed workers must still gather essential history and physical examination details to make informed clinical decisions and provide appropriate treatment. These protocols delineate the necessary actions and decisions required to manage a patient's symptoms effectively. Therefore, the committed practitioner must ensure proper documentation of all inferences made and actions taken in the management of the patient. So this important note discussed more and illustrates the importance of critical thinking and having a detailed history. Like we've been discussing, the standing orders is a tool that is meant to assist you, and as such should not replace your clinical judgment and critical thinking as a clinician. And that is where your knowledge, experience come into play. Then, as you are caring for this patient, make sure you document every investigation you've done, every assessment, every treatment you have given to this patient. It's important for continuity of care. Let's look at the likely reasons why this important note was given. Let's look at the likely reasons this important note was given. What is clinical judgment at first? Clinical judgment refers to the application of knowledge, experience, and reasoning to assess a patient's condition and decide on appropriate care. Here, knowledge we're talking about is about clinical knowledge, disease knowledge, symptomatology, pathogenesis, and every other relevant knowledge you need for you to say this person have this disease condition. So it is here you apply that knowledge of disease process, disease symptom presentation, disease progression. This is where you apply the knowledge. Then experience you have had over time and your reasoning in order to assess a patient's condition and decide on appropriate care. So that is what forms clinical judgment. So this important note is trying to let us understand that irrespective is a specific guidelines, that it should not replace our ability to apply our knowledge, because patients differ. No two patients are similar. As such, as these general guidelines in form of the standing operation procedure or the standing order, is there to guide you, but must not replace your ability to judge. Sometimes the standing orders might give you a set of likely findings. But in reality, when you are assessing a patient, the findings may differ. That therefore you should not, because this is what the standard order stated, the way you now blend the findings to match with what is in the standing orders. No. In real sense and in clinical practice, you record every findings you see or you found. As such, when you have gathered all this data and clinical wise or your clinical judgment tells that this condition is far different from what is in the standing order, you refer that condition, because even the standard order says any condition not covered in the standing order should be what? Referred. That makes you a good clinician. So you shouldn't be a robot because you have a standard operating procedure or a specific guideline that you must follow strictly. No. The people that develop this understand that clinical situations changes and there are a lot of scenarios that can face in practice. As such, you must be able to apply the knowledge you've acquired as a clinician, your experience, and the reasoning to assess a patient's condition and decide on appropriate care. Another reason for that important note is that they understand that's individualization, that each patient is unique in their medical history. Of course, we said that no two patients have the same similar medical history or who are having the same current health status. No. Or the same two patients having the same or similar response to treatment. We must not overlook idiosyncrasies. You gave this patient quinine and the patient did not react to it. You might give it to patient B. The patient B begin to have scratches or even anaphylactic shock. So we must always remember that each patient or client is a unique individual. As such, their clinical judgment should be tailored, narrowed down to that specific patient or client in order to give the patient individualized care. So therefore, before you make that clinical judgment, whether the standing order says that, you must also have taken enough details. It's when you have taken enough history, perform wider examination, you can get a lot of facts to make a clinical judgment, whether to take other steps such as referral, prescribe for treatment, judge if it's a severe condition, mild condition, or needs an expert care. Another reason is they understand there is complexity of cases. Patients often present with complex medical conditions that requires careful considerations. And these careful considerations can be from the patient factor. Who cares for the patient? Patient's health status, the patient's resources, your experience, and your knowledge. You must understand this, and you must understand this complexity of most cases. Therefore, standing orders cannot account for all these variables now in patient's health status. So, as a good clinician, you must always consider this and understand that there's complexity of cases. That is why they gave that important note. Another reason for that important note is that they understand there's a particular important aspect known as role of critical thinking. Critical thinking in healthcare involves analyzing information, evaluating evidence you have gotten from the history, from the examination, from laboratory, and then making judgments about the patient care based on logical reasoning. So they understand that you are a healthcare personnel As such, you have this ability to make this logical reasoning. So therefore, you must not allow that tool, the standard orders, to replace these logical reasonings, which always come up with or from the information you've gathered, analyzed, and evaluated. That is why they gave that important note. So you have to take a detailed history of the patient. As such, the findings you see or you got will now be a mirror that will help you make logical reasoning, which may fall back to the standard orders directive as strictly as possible, or may otherwise require you to take other decisions such as referral or pursue other line of care, or to use different sections of the standing orders to manage that patient's condition effectively. Registered committed practitioners must be able to assess situations dynamically, especially when patients do not respond as expected to the protocol. Therefore, critical thinking ensures that RUCHPs can adapt and modify their approach when necessary. This is based on data you've collected. Another reason is risk management. Employing critical thinking aids you in identifying potential complications, adverse effects, or contraindications that may not be adequately addressed by the standing orders. Like the standing orders is a general or a specific guidelines that is not narrowed down to a particular patient. Most of the times, the guidelines that are given are not gender specific. You understand? Take, for example, you want to administer care to a patient who is within the childbearing age 15 to 49, a female. It is always important to ask of the last menstrual period. You have to rule out pregnancy. So even if it's a condition of cough, fever, and headache, you must rule out this condition, pregnancy. As such, the guideline that was given may not have that. But because of your critical thinking and your experience you have had in practice, you can comfortably ask this question to rule out pregnancy. That is where you minimize risk. That is why they gave me that important note. That's why you need to have these informations and skill so that you'll be able to manage risk. Also, in the drug prescription, you might have two different adults who had a similar condition, but health status differ. That is why you have to consider health status. Renal function of a particular patient, let's say patient A, may be very poor. So the same drug dosage cannot be given to them, the two patients, because of renal functions. That is why you have to make considerations. And your critical thinking, then which leads to a good clinical judgment and a better patient care plan. And this help in making evidence-based decisions that protect patients' safety. Why do we need to gather essential history and physical examination? We've discussed that. Well, let's look at it again, one after the other. You know that a patient's lifestyle, occupation, and social determinants of health can significantly affect their treatment plan and outcome. Therefore, when you gather information that are essential, it helps you informing an effective strategy. That's why you have to take a detailed history of the patients. When did this condition start? How long? What have been done? You ask for similar symptoms, ask for family history, ask for social history, ask for immunization history, ask for occupational history, ask for past surgeries, past medical conditions the patient have had in the past. If it were to be gynecological, you ask for other conditions the patient have suffered. If it were to be obstetrics, you ask for other pregnancies, how it went. This gives you a clue and also helps you in your informed clinical decision making. Patient conditions might change rapidly. Thus, regular assessment during treatment allows for adjustment in care, ensuring the patient responds positively to interventions. That is why you need to have a detailed information. Healthcare decisions should be based on the best available evidence as well as the clinician's expert, the patient's circumstance. Okay, so standing orders are part of this evidence but should not function as a sole guiding factor. That's what we'll be able to discuss today. That, yes, standing orders provide us with a standardized evidence over time. However, patients differ. Patients differ based on their health status, circumstances, and resources. So you must consider standing orders, consider your clinical expertise and your experience for you to make a good clinical judgment. And for that reason, you need to collect good quality data. Another reason why we need to collect data is patient-centered care. You make informed clinical decisions by considering the patient's value, preference, and express need. The patient you are placing on a sedative drug might be a patient who works throughout the night. Would the two go together? You really have to consider that preference, values, and their needs. As such, the patient is engaged in their care plan. So that is why you need to take enough history. Another reason is for monitoring and follow-up. Like we said, effective treatment necessarily involves ongoing monitoring for responsiveness and side effects, especially in dynamic clinical scenarios. When you have enough history of the patient, clinical examination, and laboratory findings, you'll be able to monitor the patient because all the parameters you have assessed are there handy. You can assess this person and continually monitor this person. That is the reason why we need to have enough information and full documentation for referral purposes and patient care plan. Now let's take a complaint. This is a female of 23 years old. This is supposed to be female, not the male, of 23 years old, came with the complaint of burns of the eye with hot water. Manage with your standing orders. So the first thing you do, according to the guidelines for using the standing orders, the steps, the first thing you do is to look up the client's problem based on the patient's age. You're going to take the age, or the age would determine if you're going to use adult section, child section, adolescent section, elderly section. Then when you identify the age group, you identify the problem or complaint in the relevant section and refer to the appropriate page. In this our own case here now, the age is 23 years, so it's an adult. So we're going to use adult section. Then, since the complaint is pointing towards the eye, we are likely going to find this complaint in the eye problems. However, there are some certain conditions like signs of a particular condition like the preeclampsia that might give you headache, epigastric pain, visual disturbances. Such complaint, when you are given, if you don't have good clinical knowledge, you might find difficult to locate in the standing orders because if you follow it, they say visual disturbance, headache, you might go under headache and check, you might not see it. But if you understand that preeclampsia is caused by, the preeclampsia symptoms include this: epigastric pain, visual disturbances, increase in blood pressure, and all of that. You quickly go to maternal health and look and check up the boxes there. So that's one thing you must know. You must be very well equipped in identifying likely diagnosis, presumptive diagnosis based on symptoms patient presents. But in our own case, it's threats and burns of the eye. by hot water. It's an accident. So when you've located it at adult section, the next you ask all questions listed in the box. But at this point, you have to adapt and adopt, not everything you're going to see. Then you perform all examination listed in the examination box. Remember, we are taking enough history, enough examination for us to make good clinical judgment. They record all significant informations, including negative findings. For example, if you are checking for neck stiffness and on assessment, there's no neck stiffness, you write no stiff neck. Then select the box containing all the significant findings related to the patient's condition from the list of findings you have there. Then follow the actions that correspond to the selected findings and manage the patient's complaints as instructed. Now, we are going to use the adult section. Then eye problem. So look at, this is the adult section and this is the eye problem. Look at what we're going to do. We're going to do 5.18, page 227. That's what we're going to use. Now, this 5.7 and page 227, this is where the problem, and look at the history. This is the general history and general physical. However, this is specific findings that if you find this, there is specific to this condition, and therefore you must use this action box. If your findings from the general examination shows all of this, then it's likely that you are going to use this box. However, look at the complaint here from the history. This is what the patient also from the history. The patient had redness of the eye, pain in the eye. It's not different from what we are giving, here. However, the complaint burns of the eye with hot water, manage your standing orders. So this is what we are giving, and it's straightforward. So in this history, you are going to adopt and adapt. There are standard questions that you're supposed to ask. At least you must ask, when did the problem start? You must ask it, what have you done? What have you applied? It's very important, because when you say, what have you done? You want to know the interventions that have been put in place. Some interventions may contraindicate other interventions. So you need to ask, what have you done to it? When did it start? For you to know if it's acute or chronic condition. Okay, so in this box now, we are going to ask, we are not going to ask what is the problem with the eye, because we already know that there's burns of the eye from hot water. So we are not going to ask this question. We're going to ask, how long have you had this problem? It's important for us to know, that we can know if it's acute or chronic. Then we're not going to ask, did the problem came suddenly or gradually? No. Of course, a burn of the eye is accidental. Then, is there pain in the eye? This is necessary. We also know if it's a third degree burn, second degree, or first degree. Third degree burn mostly don't give pain because the deeper structures are affected. However, on looking at the patient, you will know. Then we are not supposed to ask, does your eye itch you? Because it's only infections that can cause eye itching. However, some certain debris can lead to that, but we have to be sensitive about that. Then we don't need to ask, did anything get into your eyes? No. Have you put anything into your eyes? We might ask this question depending on the degree of the burn. That's where your clinical judgment comes in, clinical reasoning comes in. Has any medication been put in the eye? Very necessary. If yes, what has been done? We don't need to talk about, do you have high blood pressure? No. We during assessment, general assessment, we will find out this. We don't need to ask, do you have diabetes? In this particular complaint, we don't need to ask that. We don't need to also ask, do you smoke or drink alcohol? We can ask this for general health care. We can ask, do you smoke or drink alcohol? Because this helps us in certain drugs, in prescription of drugs, on certain procedures we might like to pursue. We don't need to ask if anyone else in the family is receiving eye treatment or what type. We don't need to ask this, because this is just an accident. Okay. But if it were to be for this type of complaint, redness of eye, pain in the eye, worsening vision, difficulty in seeing with one or both eye, foreign body in the eye, or swelling of the eye. Here, we don't, the symptoms that are presented here is not pointing clearly to a particular diagnosis. But here, it's pointing straightforward that it is born, which could be third degree born, second degree born. So we immediately use this box here and ask those questions, not asking, you can't ask everything here. Then, if it were to be here it's not pointing to a particular diagnosis. As such, we are seeing redness of the eye, pain in the eye, eye worsening vision, difficulty in seeing. So we should ask, what is the problem? How long has it been for us to know if it's acute or chronic? Have you had this condition before? It could be eye infection, it could be conjunctivitis, or it could be eye infection, viral origin. You can also ask, when did the problem come? Is it suddenly or probably or gradually? They will tell us whether it's insidious. Can tell us if it's highly infectious eye infection. Then, is there pain in the eye? We should also ask this. Does your eye itch? As for this particular box, if it were viral infection, it can be itchy. But viral conjunctivitis do it. Even sometimes other bacteria related. Then, have you put anything in your eye? It's necessary for us. It could be allergy, irritant. It could be a spiritual irritant or allergy. If yes, what? Has any medication been put in? Very important for us to know. Then, do you have high blood pressure? Very important, because it could be high blood pressure that's causing the difficulty in seeing or eye pain or all of that. Do you have diabetes? Also be diabetes complications. These ones are captured in the past medical history or family history. Or do anyone in your family have blindness? Is family history. And all of. So you are automatically going to ask all these questions for this particular box. But for here, you adopt an amount because it's not everything that's relevant. That's where your reasoning comes in. And when you go to do general examination, as the patient is discussing with you, already carry out examination of this patient. Then the eye, you examine the eye for redness, watery, squint, cloudiness or whiteness of the pupil, swelling around the eye. The eyelid, you will look at if there's eversion or eversion, whether there's spores, which can be an indicator of bacterial infection, or discharge, such as watery discharge, which can be an indicator of viral infection or allergy. Then you check out the eyelashes, whether it's touching at the eye surface, which can be one of the things that lead to blindness. Some of all these tropical diseases that affect the eye, that is of chlamydia origin. Then you check the pupil size, whether it's equal, regular, and reactive to light. In the nose, blood pressure, you have to measure the blood pressure and record. Then you check the urine and shoe. So, because here is not pointing to any particular diagnosis, we expect to carry out all these examinations. Then from this examination, once we've done with these examinations, we might come up with, if the findings we've got red eyes, we got watery discharge from the eye, pain in the eye, squint, drilling of the eyelid. If we got any of this, let's say we got drooping of the eyelid, ptosis. It's not something we can manage. Then we can come up and say it's a severe condition. But if we are just red eyes, watery discharge from the eye, it aligns with redness of the eye, pain in the eye. It can be conjunctivitis, can be watery, allergic conjunctivitis. Then we can we can manage. We can say moderate condition, we can manage. Are you getting me? Then if you measure the blood pressure and the findings is that the blood pressure is high, then you can control the blood pressure. However, for this box, that is where your clinical judgment comes in. So what you found here will help you take these actions. Take paracetamol 1000 milligram, then apply pad as necessary and refer. So back to our main complaint. He said burns of the eye with chemical or hot water. When you look at the eye, you see painful discharge or not, then it's a severe condition. Wash the eye immediately with cold water. Give paracetamol 1000 milligram 3 times daily for 3 days and refer. But you have, on the first one, you refer immediately and then follow up the patient. So if looking at the second box here, if on this examination and we see the drooping of the eyelid and eyeball protruding, it's a severe condition. You must refer immediately. No need to waste time. But if you only found only red eyes and what it could be eye infection or conjunctivitis, you can manage with conjunctivitis infection and move. That is why they said it must not replace your ability to think. But for exam conditions, you're going to use this. If for this particular example or question we are giving, we are going to use this. If the findings are live, you severe condition, you take this action. Then at the end, you give this health education, advise patient of personal and environmental hygiene, encourage regular eye checkup, advise on prevention of eye injuries, give nutritional counseling, then discuss the importance of keeping home-based record with any time she comes to the clinic or hospital. So this is how you use the standing orders. For clinical practice, you must make sure you use your critical thinking ability. Must make use of a critical thinking ability. Experience, patient resources must be considered, and individualization of patient care must also be considered. But for exam's sake, you also have to display that you can think as a clinician, not swallowing everything hook and line. For this, our complaint here, we are going to use this box. This is the box. This is the likely findings. This likely clinical judgment is the actions. Then you know how to record, then give said education, sign your designation and date. You are done with the patients. So that is how to use the standing orders for exam and in practice. I believe this will help you very well. Thank you and have a wonderful time.